My name is Michael Gerber. I'm one of the nurse practitioners here at People's Clinic. I provide care to the adults, but also provide care in our urgent care. We see adults and pediatrics there as well. STIs stand for sexually transmitted infections, classically known as STDs, or sexually transmitted diseases. STIs can be prevented many ways. Number one, through abstinence, which means not to have sex, either through anal, vaginal, or oral. Not a real popular one, but nonetheless it is effective. STIs are mostly prevented by simply wearing a condom. Our clinic provides condoms for our patients during their visits. All you have to do is ask if we forget to offer them for you. We also have them in containers throughout the building now that you can also grab. Mutual monogamy, or just having sex with one person during your lifetime, significantly decreases the chances of your STIs, reducing the number of sexual partners. Vaccinations, harm reduction programs like the PrEP program, or pre-exposure prophylaxis for HIV prevention. We prescribe antivirals to at-risk individuals, and this prevents them from getting HIV and going into AIDS. So pretty much anyone who has sex is at risk for STIs. Obviously, mutual monogamy, or just having sex with one person, significantly decreases the chances of STIs, but we're human, we make mistakes. Multiple sex partners and or not properly using a condom increases your chances for STIs. And anal sex actually has a higher incidence of STI transmission as well. STIs can be passed during oral, anal, and vaginal sex. Most people are aware of that. Most people don't think about shared injectable drug equipment, such as needles. This is how often HIV, hepatitis can be transferred. STIs can be screened through urine, swabs, or blood. To improve accurate lab results, our lab partners prefer the first urine of the day. So if you know you're coming to the clinic to be checked for STIs, please come to the clinic needing to pee. Some STIs can only be checked by blood, so it's important that you just talk to your provider about exactly what you do want checked that day. Many people may not have any symptoms, so that's why routine screening is also very important, because the infection is still causing damage to the body and can be passed to others through sexual contact. Common symptoms that we see include burning when you pee, discharge from your penis or vagina, itching of your genitals, sores on your genitals, bleeding or pain with sex, pain in your lower abdomen, or pain in your testicles. If you have one of these symptoms, you should be screened for an STI. Annual screening for chlamydia and gonorrhea in sexually active, non-pregnant, and pregnant women ages 24 years and younger, and in older women who are increased risk for infection. One-time screening for HIV infections in adolescents and adults 15 to 65 years of age. Screening for syphilis, HIV infection, and hepatitis B in men, women at increased risk for infection. All sexually active women younger than 25 years should be tested for gonorrhea and chlamydia every year. Women 25 years and older with risk factors such as new or multiple sex partners, or a sex partner who has an STD or STI should also be tested for gonorrhea and chlamydia every year. Again, it's a long list, I apologize. All pregnant women should be tested for syphilis, HIV, and hepatitis B starting early in pregnancy. If you have multiple or anonymous partners, male or female, you should be tested more frequently for STIs. Anyone who has unsafe sex, which we'll simply define as not using a condom, or shares injection drug equipment should be tested for HIV at least once a year. Screening for hepatitis B virus infection in persons at high risk for infections, such as those who share injection drug equipment, multiple sex partners, or not using a barrier device such as a condom. If screening for hepatitis B due to sharing injection drug equipment, should also be screened for hepatitis C. STIs not appropriately treated can lead to infertility in women, which basically means not able to have kids. This can also lead to different types of cancers in both male and female. And in most extreme circumstances, it does cause some pretty bad infections, even disability, or not doing the things you want to do every day for a living. Most important thing, it's confidential. What we talk about stays in your charts, so unless you sign a release, that's where it's going to stay. Most of the testing is non-invasive, meaning I don't have to poke you to get things done. We can just do it with urine most of the time. Again, some tests have to be done by blood, but that'll be made clear to you during your visit. Preventive medicine is always going to be cheaper than reactive medicine. That's why we're so excited to have you come see us. But most importantly, come talk to us. We enjoy talking with our patients. That's why we're here doing this. Also, I want everybody to realize that we all come from different walks of life. Your sexual health is as important to you as it is to us. This is a safe, confidential, and open clinic. We're striving to meet your healthcare needs. So again, if you have questions, please make an appointment. We will gladly set you up with a primary care provider for the first time, or set you up with your typical provider. That's an easy one. Just call us, 319-874-3000. You're always more than welcome to walk into our building and make an appointment. I try to do that Monday through Friday. Also, for those of our patients who already see us, thank you. And then also realize that on the patient portal, you can actually request an appointment, and they'll respond to you within 48 hours.